Welcome to the Virginia Hospital and Healthcare Association's Patients Come First podcast. Today we're pleased to have with us Dr. John Mccurley, the Chief Medical Officer at Bon Secours' Richmond Health System. Prior to his current role, Dr. Mccurley has had a distinguished and varied career that, if I'm not mistaken, has even involved some time on Capitol Hill in Washington, so we'll talk about that in a little bit. We'll also want to welcome Dr. Mccurley and learn a little bit about him, so thank you for being with us today, sir.
That's my pleasure. Thanks for having me.
So before we dive into your professional resume, I'd like to just give people a sense of who you are. So if you would, just please tell people a little bit about yourself, where you're from, your family, educational background, personal interests, things like that.
I am a Baltimore native. Actually was born at the first hospital that the Sisters of Bon Secours started in Baltimore, Maryland. But I spent most of my time growing up in upstate New York. So I'm married. And this year, my wife and I, Maureen, and I are celebrating our 35th wedding anniversary, which we're looking forward to in May. We have 3 children who are all grown, 2 daughters-in-law and 1 granddaughter who, coming up on age 3, is really keeping us busy most of the time. And we spend an awful lot of time with family because we're fortunate enough that they're close. For myself, as far as hobbies go and things that I do when I'm not being Chief Medical Officer here with Bon Secours, probably the hobby that I enjoy the most is playing the guitar. So I take some time to do that whenever I can. And then Maureen and I travel locally. We get out and drive when we get the chance.
What style of guitar playing would you say best characterizes what you do? Is it jazz, bluegrass, acoustic? What would that be?
Yeah, so as I've gotten older, it's transitioned from more of a electric rock-based music to most of the time now it's just me with the acoustic guitar. And I like all different kinds of music, and I'm comfortable listening to most and playing many. But for me, it's kind of a singer-songwriter acoustic guitar stuff anymore.
Maybe in your younger years you were the rock and doc, and now you're the more mellow doc.
Yeah, I don't know that I was ever that, but yeah, I certainly spent more time playing my electric when I was younger, and I've definitely mellowed out as I've gotten older and spent more time just playing fingerstyle acoustic.
Let's talk a little bit about your education and your schooling and how you sort of got yourself on the path to becoming a physician, which for you, as I understand, wasn't perhaps a traditional path, perhaps a little more circuitous. Can you talk a little bit about that?
Sure. When I look back at my high school years and the things that I saw myself doing, you'll see kind of all through that there was pre-med and medicine in all of that kind of correspondence. But just given my background and my family's, my chance to go to college came through the Navy's ROTC program. And back when I did that, if you were physically qualified, you went to something like a surface ship or an airplane or a submarine. And so I went to Penn State on the ROTC program and there studied and entered into the Navy's nuclear power program upon graduation. I went from there through the nuclear power training in the Navy and ended up on a Trident submarine, where I spent a couple of years as division officer and actually was a department head there on the Trident submarine. My shorter tours after that were varied. My last one actually was at the White House military office, where I was the director of the Presidential Emergency Complex. And that was before medical school. And so I'd been in the Navy about 10 years at that time. But I never really forgotten the passion that I had for medicine. And the opportunity came up to go to medical school through the military's medical school, the Uniformed Services University of Health Sciences. I jumped at that chance and went back to medical school about 10 years behind most of my medical school peers. So from there, I graduated, got my MD, and then trained in internal medicine at Bethesda, the National Naval Medical Center. And it was there that, as you talked about earlier, after completion of residency, that I was selected to go be one of the physicians in the Office of the Attending Physician at Congress. And the role there is very simple. It's both primary care and emergency care on the Hill for members of Congress and the Senate and some key staff, and also for the Supreme Court. And I had an opportunity to travel with some key delegations all around the world and to take care of that unique group on the Hill for a couple of years as part of my career in the Navy. And I finished out my last time in the Navy was actually at the Naval Academy, and I was the internist there. So I kind of got to see the full gamut and retired from the Navy after about 24 years of naval service 10 years ago. And from there, I went into private practice for a couple of years and then ended up in hospital medicine with the Bon Secours health system. And I've been with Bon Secours in various roles in the interim. About 4.5 years ago, I started as a chief medical officer at St. Francis Medical Center here in Midlothian. And over the last 4 months, I've been in this new role, which is the chief medical officer for the Bon Secours Richmond health system. I have yet another commitment to college. I got my master's in healthcare administration from the University of North Carolina down in Chapel Hill while I was serving as a CMO at St. Francis.
Well, that does sound like a very interesting and unique path, from a submarine to medical school to attending to the health needs of important decision makers from both the legislative and judiciary. So that sounds like quite the interesting path to where you've come today. You mentioned your schooling briefly, both at Penn State for undergrad and North Carolina Chapel Hill for graduate school, and then also at the National Naval Medical Center. When it comes to rooting interests, where do you fall? How do you break down? Tar Heel, Midshipman, Nittany Lion? How does that work for you?
Well, given the fact that UNC just won the national championship in basketball, I would say that kind of today I feel like a Tar Heel. But, my allegiance is clearly with Penn State at its core. When it's not Penn State, I'm always rooting for either the Naval Academy or UNC. Fortunately, they all seem to have different skill sets and expertises. So it's kind of fun. I can root for whichever one happens to be doing the best at the time.
That's convenient that you've certainly among those schools, both Penn State and UNC in particular, have had some pretty storied athletic traditions. So that's always nice to have.
It's been fun.
Shifting away from collegiate athletics and back to healthcare, as you mentioned, you've been with Bon Secours for several years, but you've been in your current role as Chief Medical Officer for the Richmond Health System in recent months. If you would, could you just talk a little bit about, for people who are unfamiliar, what the role of a Chief Medical Officer involves in terms of oversight, clinical care and operations, quality, safety, all of those things? What does that involve, and sort of what is a typical day for someone in a Chief Medical Officer role?
Fortunately for me, there's no typical day. Every day kind of brings its own challenges and is unique, and I've really enjoyed that about the role and growing into it. It's certainly a privilege to be the Chief Medical Officer for a health system. It's a humbling job to be that voice as a physician leader, to try to continually draw the conversation back to being centered on the people that we care for. And I think, kind of to your question, the first and foremost role of the person that is in this job is to keep our focus as a health system and in all those components on the patient and the person that's going to come through our doors next. How do we fulfill our commitment to the community that we serve to provide care that is consistently safe and is of the highest quality, and I think that's delivered in with the utmost compassion. How we would want ourselves and our families to be cared for. And I think beyond that, we want to deliver that care, that exceptional care at the right time, every time. And I think so, kind of borrowing from the language from early in my career in the submarine force, we want our care to be highly reliable, and we want to be highly reliable in all those endeavors. So that's a center of what I do. I think another important part of that is to see things through the lens of the patient, rather than thinking in terms of the typical silos, whether that silo is an outpatient office or an acute care facility or a lab or radiology suite, to think across that continuum of care and to help to create and deliver treatment systems that work from the patient and their family's perspective, rather than from the traditional healthcare silos or provider silos. And so I think one of the exciting aspects of the job is the ability to work at developing improved delivery of care and using partnerships that kind of transcend those traditional silos and gaps that you wouldn't necessarily have expected in the past. A good example of that for us is Synergy Health Partners, which is our clinically integrated network, where we're partnering with physicians, both independent and employed physicians and acute care facilities, to deliver care across the continuum. Every level and kind of in every endeavor, what we're looking for is to see things through the lens of the patient and through their family, and look at places where not just the care that is being delivered is excellent, but look at areas where we can make the delivery of the treatment and the patient's journey through that treatment exceptional as well.
And I know that commitment to really patient-centric care is a core and guiding philosophy at Bon Secours. And for people who are listening who might be unfamiliar with Bon Secours, as you mentioned, you actually were born at the Bon Secours Hospital up in Baltimore, which I think you said was the original hospital within the Bon Secours family. Within the Bon Secours Richmond health system, I think there are multiple hospitals in Richmond region, including Richmond City, Mechanicsville, I believe the Northern Neck in Midlothian, and Chesterfield. More broadly, for those who are unaware, Bon Secours is a nonprofit Catholic health system, which again traces its roots to Maryland in the 1800s, and I think today employs more than 25,000 people. It's across 19 acute care hospitals as well as nursing homes, assisted living facilities, hospice services in 6 states. Does that cover the waterfront? Have I left anything out, Dr. Mccurley?
No, I think that's a very good representation of the Bon Secours health system here in the United States. The sisters actually founded the system in Paris, France. And I think one of the interesting things about the founding of the health system was this was a group of young women who were nurses and caring for patients that were patients who couldn't really care for themselves. They either couldn't afford or couldn't get to care. And so they were going out into the homes to deliver care in a unique way, in a way that was unusual for their time period, and that was focused on the people that they were caring for. And so I think as we see the change in the delivery system that's happening currently in our country, and as we look at the questions that face us as leaders of health systems, it's good to see that we're connected at our core with the people that actually began the ministry, the Bon Secours ministry that we're part of. So for me, that's energizing, and I think it's part of what I enjoy about being in the Bon Secours system is the connection that we have in what we do day to day with the actual foundational ministry goals that were there.
And sticking with that theme for one moment more, that notion of patient-centered care. I'm sure thinking back across your career, you've seen countless patients, but I wonder if you might share an anecdote that is particularly memorable or powerful or resonant for you about an interaction you had with a patient and how that is reflective of that really compassionate and patient-centered care.
I've had the opportunity to deliver care in many different environments, in the primary care office, working as an attending in a teaching hospital, and then as a hospitalist taking care of patients here within the Bon Secours system. And I think in every one of those areas you can find patients that just, they capture you for one reason or another. For me, I think looking at the patients that I took care of in the hospital that were aging, for whom a combination of time and illness put them in a position to have to make really critical decisions with their families about how and when to treat and not to treat. Those are the patients that I most particularly remember, and I think those are the most poignant times for me with patients. That real privilege, that honor to be able to be a part of that conversation, to work with patients and families in very difficult times, in times that are so profoundly personal, has stuck with me, and those are patients that I will never forget.
Lastly, I want to talk a little bit about some of the community work that you're involved in. Many people who are drawn to healthcare are attracted to the field because of the appeal of helping people. As we discussed, that charity-minded mission is certainly central to what Bon Secours does for the people in the communities that it serves. But I know that beyond your work as a healthcare professional, you're also involved in some other community activities as well, and I wonder if you'd like to briefly discuss some of those initiatives and the purpose that they play and the role that they serve in the community.
I'd be glad to. This is a fun part of the conversation for me. I'm very fortunate that within my role within Bon Secours that they encourage us to be involved in ministries across the continuum within our community, some that are related to healthcare and some that are related to meeting basic needs that people have. So I'm fortunate to serve on the board of Access Now, which is part of the Richmond Academy of Medicine. And Access Now is a unique organization. It positions itself to work with physicians in the community and the free clinics in the community to provide specialty care to those patients who require the free clinics to obtain their care, but who can't afford to obtain care through specialists that they need in order to be adequately treated for the conditions that they have. And it's been really rewarding to be a part of that and to develop that further with the board. And then I'm also part of the Next Up RVA board, And Next Up has a very simple motto and a very unique position. Next Up RVA looks for ways to partner with those individuals and ministries that have programs that would benefit middle school kids in the Richmond Public Schools, and we bring them together with the kids themselves in the Richmond Public Schools, and we try to match them in a way that will help develop them, to give them the opportunities that they might not have, to develop the skills that they need, and to provide the continuity that they need to grow and advance from middle school, obviously, through that into high school and then beyond. That's a very special board to my heart, to go down there and to see the kids and to meet with them and to see the opportunities that we're able to give them through that program has been really rewarding.
Well, those both sound like really worthwhile community enriching endeavors, and glad to hear about your participation in those. And I'd also like to thank you for taking the time out of your day to speak with us for a few minutes today, and thank you for all the work that you do through Bon Secours to support public health, well-being, and overall community betterment. And as an aside, I'd also like to wish you and Maureen a happy 35th anniversary.
Thank you very much. It's my pleasure to spend some time with you.
During this segment of the podcast, we like to share with our audience a healthcare story that we've either seen on TV or read in a newspaper or online, something that we found interesting and think that if you have a few moments to look up, it would be worth your while and something you might find interesting as well, particularly if you are interested in healthcare. So Erin is going to join us and share one such story. Erin?
Thanks, Julian. So this story is out of Chesapeake and is what you might call a close call. A snowplow driver in Chesapeake got a bit more than he bargained for during a snowstorm earlier this year, and his presence just after 4:30 a.m. one Sunday while clearing the roads was lucky for Stephanie and Hugh Dawson, who welcomed baby Braden into the world less than 1 hour later at Chesapeake Regional Medical Center. At 3 a.m. that morning, Stephanie awoke with contractions, but the snowstorm that had blanketed the Commonwealth the day before complicated things. See, the Dawsons had planned to have their baby at Centera Princess Anne Hospital, but that facility is a 40-minute drive away from their home without the snow. Hugh spent 20 minutes clearing their truck off a sheet of ice and promptly got on the road, but after 40 minutes of driving, they knew they weren't going to make it to the Centera Healthcare facility. Instead, Hugh took an exit off of Virginia 168 to head to the closest hospital, that being Chesapeake, but the family truck had other plans and quickly died. Hugh jumped out of the truck to flag down a snowplow, who, after being begged to take them to the hospital, got Stephanie to the ER entrance with her contractions only 90 seconds apart. Luckily for the Dawsons, the snowplow driver was able to get them to the hospital in time, and luckily for all Virginians, despite snowstorms or other inclement weather, Virginia's hospitals are open 24/7, 365. To read this story, you can search online using the terms Virginia labor and snowplow driver.
That's going to do it for today's episode of the Patients Come First podcast. You can find new episodes as they become available at www.vhha.com. You can also find episodes of the podcast on SoundCloud and on other popular podcast portals. We also encourage you to engage with us on social media, including Facebook and Twitter. If you'd like to send us comments, questions, or feedback for the podcast, you can do that through our Twitter account at VirginiaHHA, using the hashtag PatientsComeFirst. Thanks.